we divide the ethnicity into three different races. One is the Caucasians, the other is the Asians, and third I would like to put is Indians. Now in Caucasians, you have a lot of tongue volume based issues. The obstruction for a sleep apnea to happen occurs at three levels: nose, palate, and tongue. It can also happen at the level of bones, maxilla, that is upper jaw, and mandible, that is our lower jaw. And the hypoplasia or the maldevelopment or the inadequate development of all these bones can lead to a sleep apnea or difficult or obstructed sleeps, what we get in a layman's language. Now for Caucasians, the most common issue is palate and tongue. For Asians, mainly Chinese, or for that matter, Koreans, Singaporeans, it is mainly a nasal and a palatal and less of a tongue. But for Indians, it's a unique group which has got a combination of nose, palate and tongue, and hence all three have to be done. So what we call as MLS, which is multi-level surgery, which has to be done for this kind of patient at a one sitting after confirming at what the level of obstruction is what will assure them the cure. Now, role of TORS, Transoral Robotic Surgery, comes when we're addressing a tongue issue. I am Dr. Snehal Shah. I am a sleep apnea specialist. I am also a robotic head neck surgeon, and I deal with sleep apnea through robot. Now, if I do a robotic surgery for a tongue, I would do a tongue volume based reduction either of the lymphoid follicles, which are a small jaw, which are nothing but the first line of defense, which could be hypertrophic, which is grown in size, which requires a ablation. I would take into account the ablation of the musculature, the muscle which is forming the base of tongue. If that is taken care of in the midline, not going laterally, we will bring about scarring, and this scarring is going to pull the tongue forwards, at the same time increase a area, a space which is behind the tongue, what we call retroglottal space. Once that happens, patient has a reduction in apnea, which is nothing but the stoppage of breath, where the saturation on the port goes to less than 90%, or hypopnea, where it goes to less than 90% for major times. So hypopnea or apnea will go down if I address a tongue issue, not just singularly, but in combination with other multi-level sites, is what is going to give a relief. So today the role of robotic surgery is coming for tongue. Probably now, with a single port coming into the picture, we might also do a septoplasty or a couplet reductions through adenoids through a single port robot, but that is yet to come. It's going to be exciting to welcome this kind of single port system, which is going to come out now sooner or later. So that is what in today's world is the indication for TORS. Thank you so much.